Education Director and Team Leader of the Girls Education Challenge, a flagship program of the UK Foreign and Commonwealth and Development Office. And today I have the privilege of moderating a panel discussion about supporting pregnant and parenting girls to thrive in education. And on our panel today, we have colleagues from the Girls Education Challenge, World Vision, Population Council, Parenting Girls from Zimbabwe, as well as teachers and government officials from Kenya. And together we will explore how governments and practitioners can better support this important group of girls to realize their right to education. So for those of you who might not be familiar with the Girls Education Challenge, or the GEC, it is a 13-year, £855 million global fund comprised of 41 projects across 17 different countries in Africa and Asia, and reaching over 1.5 million of the most marginalized girls, many of whom are pregnant or parenting. And we at the GEC are committed to supporting pregnant and parenting girls because all girls have the right to education, regardless of their pregnancy, marital, or motherhood status. And we are acutely aware that this group is often overlooked and underprovided for. And we can see this in the myriad of social and structural barriers to education that adolescent mothers experience, even when there are laws and policies in place to protect their right to education. So this points to the fact that although laws and policies might be in place, the acknowledgement and implementation of these policies at the national, school, and community levels frequently fall short. So today we will be recognizing the unique challenges that pregnant and parenting girls face, and we'll be discussing how actors at the national, school, and community levels can support them to thrive in their education. So that said, before we introduce our panel, I just want to briefly go over a few housekeeping rules. So I think, thanks, Ellie, my colleague has put those up on the screen. So please be aware that we are recording this discussion, and it will be available on both the GEC and World Vision YouTube channels. So please check those out, or feel free to share those links with colleagues. We kind of mentioned this before, please be mindful of noise. So if you can mute your microphones, we'd be very grateful. And just for bandwidth, just to make sure that everyone doesn't have any internet issues, let's try to keep all of our cameras off unless you are speaking, and that's for our panelists as well as anyone that might be asking any questions. And speaking of questions, if you would like to be asking a question, feel free to enter that into the chat function throughout the webinar. If possible, if you could write the name of who the question is for, then my colleagues and I can direct the questions to them during our Q&A session, which will happen after the panel discussion. You might have seen already, my colleague Elisabetta has put in some safeguarding messages. They're noted in the chat. This is because we've included young people in this discussion, so just very mindful of safeguarding measures. And please do engage with us after the webinar. There will be a survey link in the chat to not only give us feedback on this webinar, but to also register your interest in contributing to and collaborating into a policy brief that will be the result of this discussion. So that being said, thank you very much. I'd like to invite our panelists to introduce themselves. We've got some very thoughtful speakers today. I will start with my colleagues who are representing the Girls Education Challenge. Alicia and Rispa, would you like to turn on your cameras and introduce yourselves?
Sure, yes, thank you so much, Sharon. So good afternoon to everyone. My name is Alicia, and I am working as a senior portfolio advisor within the Girls Education Challenge, within the fund manager team. I'm really happy to be here today. I've been working with other GEC projects in Kenya and with the colleagues on the learning team to think about what we're learning around the inclusion of this really important group of girls. So yeah, we'll be looking forward to this discussion today. Thank you. Over to you, Rispa.
Rispa, you might still be on mute. Please, could you unmute your camera?
Okay, thank you so much. I hope now you're getting me and you're seeing me.
Yes, perfect. Hello. Thank you.
Thanks. I'm Rispa. I'm from Homa Bay, Mbita sub-county. I am a teacher. working. I've done special education and I'm working in a primary school. And currently I've been working with girls, parenting girls who are still going to school. I've worked with them a lot, over 10 years. So I'm grateful to join this panel and I'm very grateful to answer any question that may be due to me. Thank you so much.
Brilliant. Thank you very much, Rispa and Alicia. And thank you again for those who have been joining. Just a small reminder, if you've joined, please can you turn your camera off and mute yourself so that we can make sure that we don't have any internet or bandwidth issues. And if you are speaking, then please feel free to turn on your camera and your microphone. Great. So now I'd like to invite our panelists from World Vision Zimbabwe to introduce themselves. So Method, Angel, Nakai, over to you.
Good afternoon, everyone. My name is Method Ndlovu. I am a program manager with World Vision Zimbabwe, and I work for a girls' education project. I'll be sharing some of the experiences from a project that ended in December called IGET. Thank you.
Good afternoon, everyone. I'm Angel. I'm 19 years of age. I'm a young mother to a son named Gladwell. I'm from Zimbabwe.
Good afternoon, everyone. My name is Nakai. I'm aged 19. I'm a young mother to a daughter called Omshi.
Brilliant. Welcome. Thank you, Angel and Nakai. And I also want to thank you as well for conducting this discussion in English to all of our panelists. I'm very mindful and appreciative that this is, second, third, fourth languages, and I really respect everyone for being able to communicate so beautifully in English. So thank you for that. So finally, I would also like to invite our panelists from Population Council in Kenya to introduce themselves. So welcome, Chichi and Mr. Kiru. Please feel free to introduce yourselves.
Thank you. Please go ahead, Mr. Kiru.
Okay, thank you very much. So I'm Keiro Frederick from Kenya. I'm a teacher by profession. Currently, I'm a director of education. I'm in charge of education in a county, and I've worked in several counties in Kenya, having worked also with Population Council, particularly on the area of reentry for pregnant girls and mothering girls. So I think I'm ready and happy to share the experiences from Kenya, what we are doing, our gains, and possibly our challenges. And thank you very much. I'm happy to be a part of this forum. Thank you.
And I'm Chichi Undia. I'm a researcher with the Population Council. Had the privilege of working with Mr. Kiru and the Ministry of Education, particularly in Homa Bay County in Kenya on this issue of pregnant and parenting girls. And we're really excited to be a part of this panel and share what we've been learning. Thank you.
Brilliant. Thank you so much. And we're very excited that you are here on this panel. So why don't we just get started with our first question for our panelists for their reflections. So since we are focusing on pregnant and parenting girls' rights to education, why is it important for us to listen to the voices and views of girls and involve them in decision making? And how best can we do this? So I'd like to first invite our colleagues from World Vision Zimbabwe. Method, would you like to start with your reflections, please?
Okay. So from my experience, it is necessary to listen to the voice of the girls because we can easily assume that we understand the challenges that pregnant and parenting girls face for them to return to school. Yet their difficulties are hidden and many. and they cannot be easily understood by anyone, policymakers and NGOs included. So to be effective in supporting these girls to receive an education, I think we need to understand their needs. Some of these girls are disabled. Some of them could be survivors of abuse and gender-based violence. Some are heading households, while some are pregnant and some are parenting. So their issues are many and varied. So the only way to really understand their challenges is to listen to what they have to say and also ask them how we can support them. And on how best we can do this, so drawing from the IGET experience, we worked very hard to give these girls a voice by bringing pregnant and parenting girls together. So we would bring them together with caregivers, with a school mentor, a community case care worker, and a community leader. And then we would focus on each girl and try to identify and understand the challenges that they face and how they feel about those challenges. And we would also ask them on how they suggest we deal with those challenges. And as IGET, we also created other ways in which girls could talk freely about challenges as they reintegrate back into school. And some of those platforms that we created included the Girls Leadership Club, where girls could speak freely. We also created a feedback and a complaints mechanism where girls could drop in a suggestion box or use a hotline. And also they could just speak to other girls who are peer leaders in their school to highlight some of the difficulties that they had in order to reintegrate into school. I think in brief, that's what I have.
Brilliant. Thank you. Thank you for that. Thank you for highlighting the important reasons why we need to listen to the voices and views of girls and how you do that on the IGET GEC program. Another example of how we can best do this is through a panel discussion like this. So I would love to invite Angel and Nakai to also give their views on why it's important to listen to the voices of girls and how best you think that we can do this. So Angel and Nakai, please. I think do our colleagues at the World Vision Office, are you able to turn on your cameras? Or are we having internet difficulties? There you are. Welcome. And if you could go off mute, we'd love to hear your views on why it's important to and how best to include the voices of girls. Can you, please, can you turn the microphone back on? We can't hear you.
Okay, we once had we once had a disconnection. So may you please come again?
I would welcome your reflections on why it's important to include the voices and views of girls in decision making and how can we best do this?
Okay, for myself, I think it is important to listen to the views of girls and involve them in decision making in this way. Some of the girls we have experienced a lot, so we have to share our our experiences with other girls so that they may be aware of some things. Secondly, there is nothing for us without us. So the community must include us in some community gatherings and some workshops in the that may be happening in the community, and even in schools they must be have a peer education club so that we may okay, on the schools, it must be having the peer education clubs so that we may tell others about our experiences so that we may be aware. Okay, thank you.
Me on the other side, I think most of the times people decide on behalf of us without involving us in decision making, and of which it has affected we pregnant girls and us young women, as decisions are made without our consent. And for example, in our community, if a girl falls pregnant, they believe that he is no longer fit to go back to education, as they believe that he'll be an adult at that stage, which is not ideal for us girls. We have to make decisions for ourselves and be heard, and our views to be taken seriously as girls. And on the other side, the community also believe in patriarchy, of which men dominates in everything. They are heads of families and they decide without involving us. And it has been a disadvantage to us girls to voice our fears and challenges, because they do it without our presence. Thank you.
Thank you. Thanks very much. Thanks very much for your thoughtful comments. And clearly, you know, when adults are making decisions without involving girls, there's a lot of assumptions that are being made, and these assumptions can be wrong, incorrect, not relevant. And you spoke about the ways in which the community can listen. So thank you for that. I'd like to invite Rispa to comment and give reflections on how perhaps teachers and people in the community can listen to girls. Rispa, would you like to come in?
Okay, thank you so much. In my view, I believe it's very important to listen to girls. Girls are a weaker sex. They don't like speaking a lot about their problems. So it's always good to identify girls with certain problems, because there are so many ways you can identify them and talk to them to get to know what they are going through. As one of us has said, some of them go through abuses, and these abuses are maybe from family members, and they threaten them not to speak about it. So the only place maybe they can speak about it, maybe in school with their teachers. Some of them are even heading families. You may not know if you don't talk to them. The parents are far away. They only do the work of sending money to them to buy food for the other siblings, which may be hectic to them. And as teachers, maybe sometimes you may not know if you don't be close to them to listen to them. So there are so many issues. Culture is also an issue. There are some cultures that girls are not allowed to speak to their fathers about certain issues. And maybe the mother is no more there. Maybe they are separated, they are divorced, or the mother is dead. So the girl doesn't have somebody to listen to her. So the only place that this girl can get services or get advice is maybe in school through a teacher like me. So that is why I understand that it's good to listen to them. And the best way to listen to them is always to be very close to them, because when you're close to them, you can understand their emotions and you'll be able to identify whether one has a problem or not. Another thing is having that peer education club, so that if the girl can't come and speak to you as a teacher, then this girl can speak to a friend, and this friend can bring you the information what the girl is going through. Another thing, we can also create a guidance and counseling programs in school. And this guidance and counseling program in school should be headed by somebody who is trustworthy, whom the learners are honest, that can take in their views and not just spread rumors about it. So there's a lot about that girls go through that we really need to listen to their voices. Thank you very much. I hope you've got me.
Yes, we have. Thank you, Whisper. Thank you for your reflections. And I'd also like to invite your colleague, GEC colleague Alicia, for your reflections as well on this question. Alicia, over to you.
Thank you, and thanks to all colleagues who've just spoken so articulately about this. Really, really great to hear. I just wanted to bring in a perspective that on the GEC we got last year from our discussions and our research with the projects in Kenya. Something that came out quite strongly is that across the research base, practitioner-led research and academic research, there's been a really strong historic tendency to look at the prevention of adolescent pregnancy. And that's, of course, really, really important. But there's been comparatively less of a focus on what do girls who are pregnant or parenting and want to be in education, what are their views, what are their needs right now? And of course, that's really important because if we don't listen to that perspective, we're not meeting the immediate needs and being allies for those young women. And some of that literature also could be sort of as perpetuating what we might think of as like a deficit discourse. So sort of positioning those girls and young women in that situation as a challenge to the education system, or something that makes meeting education-related outcomes more difficult. And there's another way of looking at it, which is to think really positively about this group of girls. How are they contributing to schools and communities? How are we ensuring that their rights are met? So I think something that really stood out to all of us across the GEC in Kenya was that disconnect between what the research and the data tells us about including young mothers and then what girls themselves are saying can sometimes be quite stark. So just to give you a quick example, sometimes there is a lot of emphasis on the role of the counsellor within the school. And this is really important. It cannot be understated. But when we talk to girls on the GEC, many of them were talking about other problems. Method described them as diverse, complicated, individual, and multiple. And so we need to listen to all of those different kinds of challenges, those different kinds of solutions that are coming from girls to avoid that sort of peril of making assumptions. And to the latter part of that question, something that we learned is that the role of the woman who can be an ally, a young teacher, a counsellor, a community leader, another young woman who can really listen to girls over a long period of time, giving that space and time, is very, very valuable. So that's something that we found out quite strongly.
Brilliant. Thank you, Alicia. And again, thank you for reminding us, lots of brilliant points in there, but just that single-minded focus on prevention really does overlook those who are currently pregnant or parenting, and that is not fair, or just considering, again, that every girl has a right to education, irrespective of their situation. So thank you very much for those thoughtful reflections. I have a second question, and this is more about the system and school and government actors, and how best can the system and the system actors support pregnant and parenting girls with their education. So I'd like to invite our Population Council colleagues, Mr. Kiru and Dr. Chichi. Do we know what support system actors need, and what are system actors doing, and what could they be doing? Over to you.
Thank you. Maybe I'll just start out and then hand over to Mr. Kiru. I think we do have some sense of what system actors need, at least based on what we've learned from our work in Kenya. And one of the key things that we've learned is that so-called system actors, they're human, they're logical. They respond to compelling evidence, even when it comes to sensitive issues such as continued education for pregnant and parenting girls. And the system can support these actors, we found, by sharing evidence that's obtained right from within the communities of these actors so that they feel a sense of responsibility and a sense of ownership. And some of the studies that the Population Council has carried out collaboratively with the Kenya Ministry of Education found that of the vast majority of out-of-school girls in the county that we're in, which happened to be Homa Bay at the time, so nearly 70% of these girls had dropped out of school because they got pregnant, and out of those, a whopping 80% had actually dropped out at the primary school level. And then we also learned from further studies that nearly a third of girls aged 12 to 16 who had ever been pregnant in this setting got pregnant as a result of sexual violence or coercion. And so these statistics and realities, they are really sobering, and not just for us as researchers, but for the other system actors that we've engaged with. And our experience has been that these kinds of figures, these kinds of data help to foster the support and the solutions that girls need. Talking about system actors, let's also remember that the system is about partnerships. And the Population Council's work as a research organization has really involved generating the evidence and then working with the Ministry of Education in that process, and working with them to ensure that the evidence and policy information gets to a wide variety of stakeholders in order to spark critical conversations, to spark critical thinking, and ultimately to spark solutions. Few gatekeepers know enough about the policies that already exist for keeping pregnant and parenting girls in school. Our studies have found that up to a third of school principals weren't aware of the key policies that were designed to ensure that affected girls remained in school. And most of those who had heard of these policies weren't sufficiently familiar with their content. So these really are, key issues. And then lastly, I would say that we've used this evidence for advocacy, essentially. We have used this evidence to help prepare the minds and the hearts, so to speak, of the gatekeepers, with school principals being chief among these gatekeepers that we're talking about, but also parents and community members. What we've done with these data is to help prepare system actors for the task of providing a supportive atmosphere and a supportive environment for girls, both in their homes and in schools. And Mr. Kiru really shepherded this project, this process in Homa Bay County. He can talk more about the avenues that we use to achieve these goals, so, whether it's through the policy dialogues with school principals, or whether it's through the interactive radio programs with the entire community, or whether it's through the Forties program. So Mr. Kiru, over to you. Thank you.
Thank you very much. I'll speak as both as a participant with the Population Council and also as a government official from Kenya. I would say that actually the government in Kenya recognized the importance of not excluding our pregnant girls and teenage mothers quite early. And in terms of the systems support that we've had from experience, I would start with what I can call political goodwill. When we have even the president speaks into this matter, the minister speaks into this matter, that we need not to exclude the pregnant girls and the mothering girls also. So political goodwill is a very important anchor. Secondly, in Kenya, we've had the light legislation. Legislation whereby now everything is anchored into the law, such that light from our constitution, it offers education as a basic human right. Our Education Act talks about quality education for all and should be free and compulsory. That means that we are not excluding anybody, including the mothering girls and the pregnant ones. So this one is the law, the constitution. Then number three, we've got the right policies. I can say that this was recognized quite early, right from 1994, when we had the first policy on re-entry of these pregnant girls and mothering girls back to school, so that they were not excluded, so that we could improve retention and transition. So policy is one of the major systems that system support in Kenya. And right now in 2020, this policy was re-engineered again, and guidelines were produced to ensure that, and with a very clear framework on what needs to be done by who and when, so that these girls are not excluded from school. So I would say policy and actually enforcing the policy. And as Dr. Chichi has said, and I'm going to explain a little about that. Then we have got what the government in Kenya has provided administrative support, whereby the government officers at various levels, at the county level, sub-county levels, are well sensitized, and they are able to take their place in ensuring that the girls are re-entered back to school. Actually, this one becomes like a mop-up every year, whereby these girls, we track them, as Dr. Chichi has said, we trace them from wherever they are using the administrative structures. Actually, one unique thing about what we've already done here in Kenya is even across the border. Once we track them where they are, could they be in Uganda or even Sudan, the system is able to bring them back to school after tracing them to ensuring that they are all back to school. So that one is something that we have done, and it is continuous. The other one is the 100% education transition policy, whereby the policy states that, like from primary to secondary school, all children should transit, and it is seriously enforced by administrative officers, by political leaders. It becomes like, a corporate responsibility that all our children need to transit. And that means that our mothering girls, our pregnant girls are not left out, and they are also a part of these children. So this is also still at a policy level. Then the other support area is training and sensitization. And I want to appreciate the work we've done with Population Council, whereby we have trained even almost 1,000 head teachers, administrators, and education officers. First of all, they understand the importance, they understand the issue very well, and that way they are able now to embrace the policy of re-entering our girls as a corporate body. So we work in unison to ensure that these children are back to school. So capacity building has really been a part of it. Not forgetting collaboration, a lot of collaboration with partners. Like as I've indicated in Kenya, we've got very, very good partners that we work together with, like Population Council, World Vision, EggPath. These are some of the few, even Red Cross, they come in hard at a particular time, because sometimes we need to trace these girls where they are, right from their homes. We bring them back to school. Even the medics, the Department of Health, we realize many of the times our mothering children, our pregnant girls require the medical care and some action from that area. So now, to speak on the same, other than the training, is dissemination of materials, which is very important, because as I've indicated in Kenya, we have produced guidelines for re-entry back in 2020, and with the help of the UNICEF and Population Council. So we need to get the actors to get these guidelines, be educated on them, and like it has been said in Homa Bay, Nairobi, Narok County, we have had very, very good results, whereby we have meetings, dialogue meetings, training meetings. We train various cadre of people so that they are able now to embrace and help us reach these girls. We have even also used even social media, the radio. We have had radio program. We invite mothering children, pregnant girls. They come over, They give their experiences and their stories, how they have been able to overcome the challenges. And this way we are able to have better outreach and better results from that. Then the most important, before I conclude, I would say is the support we get at the school level. And I want to thank Population Council again, because with their help, we've been able to train very, very many head teachers and teachers on reentry and the needs of these children. Because as it has been said by another speaker, these girls have got unique needs. They need to be treated in a particular way so that we remove the stigma, we remove the fear, and bring them back to school. So in Homa Bay, we had the 40s, whereby we are tracing, we are tracking, we are talking to them, and then re-entering them back to school. So the support that we can get really from the school heads is very, very pivotal, which includes actually helping us to trace where these girls are, helping us to document the cases and their issues, and maintaining confidentiality, and also providing guidance and counseling for these girls. They need to be debriefed. They need to be assisted with information. Some of them, they are even not aware that policy allows them back to school. So once they get to get information, they'll be easily be absorbed back to school. As I say, information is power. And even their parents, we realize that sometimes their parents need to be talked to by the teachers who they trust. And these parents now are able to bring these children back to school, other than also being a linkage with the community. Then very important point I want to say here, and this is from my experience, the head teachers in schools are able to provide some support system other people may not be aware about. Some of these girls come back to school with their infants, small children. They need to be given a safe place to keep the children, some place where they can do the lactation or feeding the children. You know, they also need to have someone who can be able to be trusted and to give them a shoulder to lean on. So this one, we only get them from our head teachers, who they can really trust, and also the teachers. Other than the safety, because also these children require safety. They need to be protected from stigma, from people who, you know, would want to talk them. Like in Kenya, the experience is that you may want to know that we have array marriages. Some of these children, we pack them from homes where they've been married off, and we bring them back to school. So they need to be assured of their safety and security, which is best provided by head teachers and also the administrators. And then, of course, creating awareness to the parents, to the community, and to all the people, so that we work, because this is not a small task. It need to be a corporate responsibility where all of us are involved. The head teachers and teachers here in Kenya have also really assisted us in disseminating the policy guidelines and actually, you know, demystifying the whole issue of teenage pregnancies and mothering children, you know, like if it's a disease. So demystification of this issue, making it you feel, oh, yes, they are also supposed to participate in education for all. They are also supposed to participate in SDG 4 for quality and inclusive education. So when they assist us in this dissemination, we are able to achieve better results. Finally, actually the issue of health, providing information to these girls about how they can access health facilities and services, because most of the time we have realized from experience they require these services. Sometimes they require food, they require good nutrition. Some of them are from very vulnerable and disadvantaged background, and as a result of that, we need to link them with the right people who can assist them. So I think in conclusion, you can see that the system has a lot that it can do and will continue to do to ensure that these girls are re-entered back to school. But as I want to emphasize the issue of policy, the issue of anchoring this matter in the laws of the country, and also engaging everyone and all the partners so that we can have good success. Thank you very much.
Thank you, Mr. Kiru. That was very inspiring, and it's really wonderful to hear about all of the great implementation work that's happening in Kenya and the political will that is accompanying the policies in Kenya, and still that there's still a lot of work to do. As you and Chichi both noted, that there still are a lot of head teachers that aren't aware of the policies yet. So, but it is very promising to hear about all the work that you're doing. So thank you for that. We'd love to hear too about, that implementation. Particularly, I'd like to invite Angel and Nakai to give their reflections on their experiences of what support from their schools and mentors and employment, what has helped them most when trying to return to education. So Angela, Nakai, would love to hear your reflections on the support that you've experienced when trying to return to education.
Okay, the support I got from school mentors is that before that one, talking from my experience, I got support from my family at first by agreeing to take me back to education, and of which they supported me financially. And in my community, the neighbors also gave me support, both negative and positive. Negatively, I had to wake up early in the morning to prepare my baby and give him food, then go and leave him to the neighbors. Then at times I would lose track of time and go to school late. And positively, they kindly took care of my child when I was away from him. And the support I got from school, my teachers and mentors, they gave me time to take care of my child and to balance both studies and taking care of my child, which was the support I got from the school. And my mentor, who happens to that, he made me join the girls leadership program, and of which I was the leader of that program. I was the peer leader. That inspired me to share my experience with other girls, what I've gone through. And that was the support I got from the school and my mentor.
Okay, the support I got from my school. By the time I went back to school. By the time I went back to school, I was afraid and I lost confidence. And through the peer education, since I was a peer leader, it helped me to regain back my confidence. And through visioning, we were taught about visioning. So I visioned, I knew what was my vision and my priority. So that is what I stick to my education as my priority. Then the school authority helped me by putting the stiff penalties to those learners who were talking negative, or those learners who ill-treated us. And I also got the support from my mother as we made a decision, and we sat down and we took a decision that I should have to go back to school and regain back my education. And also the support from my grandmother. My grandmother was the one who was left with my child when I was going to school. And also some literate family members helped me, and they saw it important for me to go to school. So they made it a point for me to go to school. Then taking back to 2019, the time I was pregnant, I went for the vocational trainings in St. Francis with the CBE program from IGET. Then that's why I had the life skills, and I did hotel and catering. After that, I I started practicing baking. Then I was given a startup kit. That's when I started my business. I started baking buns and selling them, and I raised my money to that extent that I bought my stationery and I paid my first term school fees. Unlucky, I failed to continue with my business as I was balancing my studies. Thank you.
Thank you. Thank you, Angel and Nakai. Thank you for sharing your experiences. And again, very inspiring and positive to hear that you got so much support from your families, your grandparents, your neighbors, and teachers. And wonderful to hear also about, you know, the iGate program and the sort of peer groups and peer leadership opportunities that you had, which helped. So thank you for that. I'd also like to invite our colleagues from the GEC to give their reflections on how system actors can support pregnant and parenting girls and what support those system actors might need. So Alicia Rispa, would you like to come in?
Rispa, go first, go ahead.
Okay, thank you. I hope you're getting me.
Yes, perfect. Thank you.
Thank you. Back at school, there is a policy guideline that once the learner is pregnant, there's always a document that the head teacher writes to the Ministry of Education to let them know that there's a learner who fell pregnant and left school. So after that, it's through the administration, the police, to go through and find out where this learner is. If the learner is at home, well and good, can always be visited by a teacher to find out how the learner is doing back at home until the time the girl has given birth. And then in Kenya, we have a policy of 100% transition. So learners are not denied access to school, even if they are parenting, even if they are mothers who have children back at home. They are always allowed to come back to school and even continue, even if it is from primary, they continue to secondary school and accomplish. So the head teachers and the principals of primary and secondary schools know that it is a policy in Kenya that these learners must go back to school and they must be given that good attitude and that good atmosphere of learning until they complete their education. But there's always a challenge because some of them do not have people to take care of their children back at home. So they leave their children at home, but they are in school, but they are not stable because they are worried about what is going on back at home. In school, we don't have systems to take care of these children because we don't have a daycare. We don't have a place where the learners can put their children as they are in class so that they run maybe during short breaks to breastfeed their children. So that is the only challenge that we still have that I believe that the government should look into to see to it that those learners who are parenting, those mothers who are still going to school, they should have a place in the school environment so that if they don't have someone to take care of their children back at home, they can carry them to school and let the teachers help them and assist them in taking care of their children in school. So that we have areas, we have a room maybe with some beds, some things for the children to play with so that when they are in class, they are comfortable knowing that the child is safe and the child is somewhere that they can access if they don't have somebody back at home. Then our education is basic education. It's education for all. So none is denied the right to get education. That is in Kenya. None of us is denied the right to education. So once the learners or these girls get pregnant, we always try to trace where they are, even if they run away, because some of them run away because of that stigma. So even if they run away, the administration, the head teachers, the teachers will always be meant to the community members to find out where they are, and then they are brought back to school because education in Kenya is basic and it is a right to all. In school also we have peer education clubs for the girls. and even for the boys, where they can speak their minds. So these girls always have an opportunity to speak to other girls about what they are going through as mothers. And through that, they also tell it to us as teachers. So it helps us a lot to find out more about what they are going through and even offer assistance if possible. The government also sometimes offers sanitary towels to these girls, which I think is a very good idea, because coming from Homa Bay, along the lake region, it is a poverty-stricken area. So sometimes they don't get these things, and they can get them through the school environment. So the most important thing that I can say that happens in the school, we have been trained to accept them the way they are, because all of them, regardless, because some of them even got through this through rape, and so therefore you cannot stigmatize a girl because she is parenting or because she is a mother. So we need to understand them. After understanding them, if they run away, we trace them where they are. We bring back that information. If you are a teacher who is close to the girl, you try to find out what the girl is going through as she's parenting, as she's being a mother. And so as some areas that I believe that the government now should do is try to have a place within the school compound, a room, a place within the school compound where these girls can leave their children if they don't have a place to leave their babies. That one is the only thing that now I believe the government should do, because if it has given them the opportunity to come back to school, what about their children back at home? Just as a mother, you always believe like you want your child to be safe because you're already a mother and you want your child to be safe even if you leave her somewhere or him somewhere. So how best can this be done? It can be done by having a place in the school compound where we have maybe matrons or mentors who are taking care of these children if the girl doesn't have someone at home to take care of the child. But I appreciate what the Kenyan government have done by tracing them, by giving us 100% transition, that is from primary to secondary school, regardless of your situation, regardless of whether you are a mother or not. They are making education a basic right to all so that everybody can get this education, and even provision of some funds to buy the sanitary towels for the girls back in school. But still a lot need to be done, like I have said. Thank you so much.
Thank
Yes,
you, Rispa.
Yes.
Alicia, did you want to come in?
Thank you, Rispa. I agree with what you and everyone else has said, and I think that was also a really you really powerfully made the case, Rispa, for childcare, which is something that the girls that we talked to as part of this research that came out really strongly. Just something I think we can all think about in addition is that when we think about school level support, as the title of this webinar sort of tried to get to, we're also thinking about how we help girls to not just access, not just be within school, not just to re-enroll or enroll, but to really thrive. And something that girls are saying to all the GEC projects in Kenya is that for them, that thriving is to do with feeling safe, having friends, expanding their capabilities, but it's also to do with doing well, by which I mean academically well in school. So understanding and learning is really, really important to this particular group of girls, as with other young people. And so when we think about this support at the school level, but within the wider system, I think it's kind of helpful to consider, how can we support the people who have who are taking on that responsibility to help those girls to thrive? So just to give you a quick example, this came from one of the GEC projects, I Choose Life. They narrated an amazing story about a really strong teacher, I think this was in Meru County, who had gone out of her way to do things like take girls to antenatal appointments, to spend her evenings trying to catch them up on curriculum that they've missed during the 3 months that they were out of school. She was going to make home visits to their families to encourage the families to be really supportive. This teacher was an extraordinary individual, doing really extraordinary things for those girls and making a huge difference. that teacher was able to do that because the head teacher was incredibly supportive, as Chi-Chi and Mr. Carew were speaking to, the importance of that head teacher, but also the head teacher was supported by a curriculum support officer who was understanding that inclusion is a marker of success. And then that curriculum support officer was working within a particular system that everyone up that chain saw the value. And so all of those people felt incentivized, supported by their line managers. And I think that's really important because we also saw a great many individual teachers or head teachers or other people within the system who were already stretched, already with big workloads, who weren't receiving any extra pay or any extra incentives for doing this important work. And they felt that this was a big ask. They wanted to do it, but the system was structured in a way that sometimes made it difficult for them to do that. So I think this is a great opportunity for practitioners to look at how systems reward or enable those amazing individuals to be able to act on their intentions to support these particular girls. So yeah, I just thought I'd share that because I think that's quite interesting thinking about it from a sort of systemic point of view. Thanks.
Brilliant. Thank you. Thanks, Alicia. And thank you for all of our panelists for their very thoughtful reflections on that question. I'd like to now move on to our last and final question, which is we talked about sort of the systemic structures and constraints and issues. And what are other conditions that are necessary to support pregnant and parenting girls to thrive in education? So I'd like to invite Method from World Vision in Zimbabwe to provide your reflections, Method, on other conditions or systemic conditions that you reflect on that are necessary to support pregnant and parenting girls.
Thank you so much. Maybe my first comment would be, I think as we try and support pregnant and parenting girls to thrive in education, I think we need this collaboration between the school and the community, basically to address the three key concerns that the girls have highlighted. And these relate to financial, they relate to child care, they relate to bullying and stigma. Very, very important. I think if the school and the community would collaborate and deal with those issues, sometimes in certain places, there will be a government bursary for these children going back to school, so the school could organize that. I think if we are able to deal with those three key issues, the girls will be able to re-enroll and thrive in school. The second thing I would like to raise is, so there are very, very few marginalized girls who are able to return to school unless they are supported to do so. So I think it is very important that as we look at formal education, we also look at the non-formal education route. And as I get, we were able to utilize the non-formal education route through a program that we called community-based education. So we would allow these young mothers to enroll in a program where they learn, where they go through modules in financial literacy, and they also do a vocational skills training in an area of their choice. And we found that this route was a key enabler in allowing the girls to transition back into education, just like Nakai was sharing her experience. So what we would do in that area is that we would allow the girls to go into a vocational training center, and they would take their babies to the vocational training center. And there will be full-time lecturers or tutors taking them through their modules. And so they would actually be able to still attend to their baby at the vocational training center. And our experience was that 75% of these young women who participated in community-based education had positive transition outcomes. And actually 89% of them were able to start an individual or a group business. I think this was very important in gaining financial independence and being able to provide for the needs of their child. And so it also helped us to change the perception of the communities towards these girls. They became role models, they became breadwinners in their families. So it helped us to change the negative attitudes and stigma that they were facing in their communities. And I'm glad to say most of these girls actually have gone back into the formal system. At the same time, they are running their own business to finance their education, to support their child, and to support their family as well. Thank you.
Brilliant. Thank you, Method. And again, really inspiring to hear about all of the remarkable things that the iGate program is doing, and particularly around what you were saying, stigma and attitudes. And so I'd like to invite Angel and Nakai. I can imagine that sometimes communities aren't supportive of pregnant and young mothers returning to education. So just from your perspective, what do you think helped change the attitudes in your community? Would welcome your thoughts.
Okay, it's Nakai. Through the help of the NGOs World Division, it helped the community to change their minds because they knew what it was going on the CBE session. Then the community realized that there are some people outside of our community who are the soldiers, who are working in the government, who are the girls. So they have to allow us to go back to school. And through the Education Impact Act, the government allowed the pregnant girls to go back to school, so the community saw it positive. So they allowed us to go back to school without saying anything.
What changed the attitude of the people of our community is that they saw that some girls that dropped out of school due to pregnancy and parenting, those girls some of them are brilliant, that they can be a better, what I can say is that they can do better at school and be better people in life. So that's the thing that changed the attitude in the community. And my current situation, I'm in a child-headed household and I'm the head of the house. So sometimes their attitude came from that being in a child-headed family. We children sometimes can be wayward, and that they believed that encouraged their attitude in us returning back to education. And the Education Amendment Act of Zimbabwe also made their attitude change because they saw right through us that we can do better. They say to educate a girl child is to educate a nation. So that helped a lot in changing their attitudes. Thank you.
Brilliant. Thank you. Thank you so much for your reflections. It's really helpful and thoughtful to hear. I'd like to also invite Rispa. I know that you have some reflections on other conditions that are also necessary to support pregnant and parenting girls to thrive in education. So Rispa, please invite your thoughts on this.
Okay, thank you so much. Okay, I currently did a research. We were working with Alicia on a research on these parenting girls, and I realized two things. One was poverty. It's poverty that makes some of the girls to go for early sexual relationships because of the poverty back at home. So it means that we need to give some financial support. This can come from school and be given to these parenting mothers. Because if they went for this when they didn't have children, now what about when they have their children, they have their babies? They need a lot. They need a lot of money now to ensure that their children are well taken care of. Because you see, as a mother now, they need money maybe to buy Pampers, to buy food for the babies. So one thing that I'll request for is the NGOs who are coming in, even the government should identify areas of need of such girls and give financial support. That is one area that I realized. Another thing is medical support. Some of them do not know what they should do. They don't even know that they should go for antenatal clinics. And you see, coming from an area where HIV is it's so high. So maybe they went maybe for only one test and they never knew whether they got the virus. So they should also be educated about the kind of diseases that they may have got through that sexual relationship. So I believe that one also should be done as a way of supporting these girls. Even in schools, the medics can come to school wherever they feel like it's good for them. That one I believe should be done. So I've talked about financial support, medical support, and then fighting stigma and discrimination back in the community and even the school. Even during my research, I realized that some of these girls were not able to talk to their parents about what they are going through because they felt like even some community members were discriminating them, were stigmatizing them. That is making them to run away maybe from school. So that one should also be addressed. How best can we talk to the community members so that they see them positively? Because like I told you before, some of them didn't get these babies out of their own making. Some were raped, some were because of some family members who did this to them, and they were told, like, if you speak about it, I'll kill you, and then they keep quiet about it. So they are here, but somebody thinks that it's their own making, it's their fault that they are now having children. Some of them, it's not their fault. So we need to fight stigma and discrimination. Then back at school, our government, the teachers are very few. This is a challenge. So sometimes recovering for the lessons for these learners to help them thrive academically, it is not easy in Kenya. You find that a school has 5 teachers, the classes are 8. You go an extra mile. At the end of the day, you are tired. At the end of the day, you cannot go beyond what you have done. So these girls are left out because they take breaks. They need to take their children for antenatal clinics, they'll miss classes. Sometimes they come to school late because they need to take care of their children in the morning before they come to school. They'll miss the classes. Coming back maybe in the afternoon may be an issue because maybe they needed to take care of the child and make sure that they maybe leave the child when he's clean, sleeping. They miss the afternoon lessons. So you find that they miss a lot. And maybe there's no teacher to take the remedial lessons for these learners. This child may not achieve academically, even if she's a bright child. So I was saying like the government need to be sensitive about this so that these learners should have an extra tutor. So we have more teachers in school so that these learners, when they come back to school, at least you can take your time as a teacher and take care of the lessons that this learner missed. Because most of them, some of them are average learners, some of them are very bright, some of them are very good, they can do very good things. There are so many girls who have gone through that and have gone back to school and have made very good opportunities in Kenya. There are doctors, there are teachers like me, there are nurses, they are even good business ladies outside there just because they were given that opportunity to go back to school and exercise their full potential. So I believe the government should work on this so that we have enough teachers in school so that some teachers can take remedial lessons and take care of the lessons that these learners may have missed when they are away for their antenatal clinics, when they were taking care of their learners that made them late to come to school late. I believe such things should be done. Thank you so much.
Thank you, Rispa. Those are, again, really thoughtful and helpful points and ideas and suggestions that you have. And I also really appreciated that you reiterated the comment about stigma. And often there's, again, that judgment or assumption that, these girls are in a situation of their own making, when in actuality, a lot of times it is forced and coerced sex, and people don't acknowledge that. So I'm really appreciative that you acknowledge that again. Alicia, I don't know if you had any further brief reflections on this question about other enabling conditions to support pregnant and parenting girls. Did you want to come in?
I'll be very brief because I think that the point that I thought maybe would come up during this discussion, and it really has very strongly, is around the role of money and around the role of poverty. And I think I saw some colleagues on the chat also agreeing on the importance of that. And it's in the research that we did and what the projects in Kenya have found so strongly is it is a huge. The lack of money is really just a huge barrier to actually being in school, but thriving in school. Rispa was listing some of the reasons why it is even more difficult when you're pregnant or when you're parenting to get that money together. There's also a higher opportunity cost. But just something that I thought might be worth saying is that a lot of the projects that have done really well in Kenya with regard to supporting these young women to thrive within educational settings, those projects, they met that need. All of the projects who've done really, really well and been really inclusive in this area, all of them gave out cash transfers to those girls, sometimes cash transfers plus extra items, such as sanitary towels, for example. So we can, across the evidence base on the GEC, see a very clear link between meeting that financial need and educational opportunity. And something that would be really great to think about, perhaps this is something we can all explore in our influencing work, is how we can support governments who are thinking about their social protection systems to replicate some of that alleviation of the financial burden. So many of the countries in which the GEC works, including Kenya, have good social protection systems with cash transfers, as an example, that often target some of the most marginalized people in communities. Those systems or that provision of cash transfers is not necessarily open to adolescents, and it's a complicated issue to discuss. There are a lot of different factors involved, but there's something around how can we be thinking about how that meeting of that financial need can become institutionalized within ministries of labour or social protection. And additionally, Rispa talked about the health need. I know many projects working in Kenya and I think across the GCC do things like try and link families up with existing health insurance programs. So if those exist, how can we as practitioners be better at helping families know that that opportunity exists, know that free healthcare might be a bureaucratic pain to get, but it is possible with the right navigation and with the right administrative support. It's possible. So I wonder if there's more that we can be doing about that, creating the linkages and being more ambitious in our influencing. I know that many of the GC projects have done a great job on this, and it's been really interesting learning from them. Perhaps we'll share. But thanks. Thank you so much.
Thanks, Alicia. Fantastic comments and ideas as well. As far as sort of programming and linkages and interventions. So, and that kind of leads nicely into our sort of question and answer session of this discussion, because we've definitely had a lot of commentary in the chat. So thank you for all of your thoughts and reflections. And first and foremost, thank you to all of our panelists for their thoughts and reflections. Angel and Nakai in particular, I just wanted to read a couple of thank yous from our audience. They've said, thank you to the girls for sharing your stories. It takes a lot of courage to come back to school. Well done. And that's from Maria. And from Emmeline, it's really important points from Angel and Nakai. Bolstering girls' support system, including their immediate family and caregivers and community, are all very crucial, but often overlooked in policies. And Sarah also made a comment, great presentation. Thanks to all the presenters, especially the young mothers, for sharing their feelings so openly. So thank you to all the panelists and especially Angel and Nakai for their courage, not only to come back to school, but to come to this panel and to speak in so eloquently in second, third, fourth language. So thank you for that. Sarah also had a sort of follow-on question, and this was for Method, on how are informal education options funded? If they are donor funded, are they really sustainable? Method, do you have any comments or reflections on that question from Sarah?
Okay, thank you so much for the question. So in answering the question, let me say that as we were going into the non-formal route, we collaborated formally with the Ministry of Youth, who have the mandate in country to train on vocational training. So we did not, our collaboration culminated in us coming up with a short course curriculum. So our trainees were taken through a 4-week training program. So we standardized the training curriculum. And secondly, so we also agreed on a certification model for all the trainees who would have gone through this kind of training. So in terms of the funding model, so our learners will go to a vocational training center for training for a 4-week period, and they'll be using facilities that are owned by the Ministry of Youth. So the Ministry of Youth would carry that cost. So there was also the cost of course instructors. So the ministry would carry that cost, And for us as a donor funder, we were taking the cost of training inputs and also the cost of training provisions. But just to add, so you can see that there was co-funding here and that the model is being developed together with the Ministry of Youth. And maybe just to add that just last week, the ministry came back to say, let's agree how many people are going to train in 2022. And we agreed on 600 of these out of school learners, including parenting girls. And so this time they've taken the responsibility as well of actually funding the food provisions for the training. But what I can tell you is that the ministry has liked the model. I can see a situation where they are going to upscale it nationally and be able to fund it as well. But my last comment will be, because when we were training these girls, we also had opportunity of showing on national television what we were doing. So we are also getting a lot of interest from other partners who would like to come and participate in this cause. Thank you.
Brilliant. Thank you. Thank you for your reflections on that. I have a few more sort of questions about programming. So Charles has written, that's an excellent session. It's been very informative. And he has one question about community support. Does it require pre-existing community-based concept already in the society? Charles, I don't know if you're still online, if you wanted to sort of clarify that question. But perhaps Method or Chichi, Mr. Kiro, if you had any thoughts about community support.
Thank you very much. Yeah, my question was, first of all, thank you so much for the presenters. This was very, very, very insightful. Yeah, I was wondering that, community support seems to be very critical in this case, but it can't be taken for granted. In many societies, for example, we don't have existing concepts of community-based, like a peer educators or something like that, that is really community-based, so that it's difficult to really just address it for the case of parenting and pregnant girls. There needs to have been a system before of, I don't know how they call it. It is community-based, like in Rwanda they call it, I think, something. But somewhere where there's already a system that mobilizes the community to address issues. So was that critical? Because if it doesn't exist, I don't know whether it can be created for the sake of only the pregnant and parenting girls, or how easily it can be done. Yeah.
Would you like? I can take a stab at that, Sharon.
Yes, please do, Chichi. Go ahead.
Sure. One of the things I can say is that, there are a lot of different programs that exist already, and there's not necessarily the need to reinvent the wheel. Several, and including one developed by the Population Council, which really is an interactive media campaign that helps draw the community into a shared conversation about the issue of pregnant and parenting girls, and helps the community begin to shift in their minds in terms of the stigma that's often attached to these issues. And the episodes of the program are available in English. They can be easily translated into different languages, and so on and so forth. That's one, of several things that exist out there, which I think we need to continue to replicate. I hope that's helpful. Thanks.
That's helpful, yeah. Existing systems will piggyback on this one. Thank you.
Brilliant. Thank you. Thank you, Charles, and thank you, Chichi. I'll move on to our last question, and this is from Umba, and she writes, ensuring participation of pregnant girls with children also depends on the support system they have around them. Can we hear from the girls, Angel and Nakai, on the panel, on what strategies worked in getting their parents and partners and guardians to support them? So Angel and Nakai, do you have any reflections on what strategies worked in getting your support systems, people around you to support you? Angel or Nakai? Is your connection still there? Hi. Welcome. We would love to hear, what are your thoughts? What were the strategies that worked in getting your parents or guardians to support you?
My vision, that it was my vision to go back to school, and I always discussed with my friends what they learned at school, and that my parents listened to my decisions as a young parent that I want to pursue with my studies. Thank you.
Okay, my mom knew that when I grow up, I wanted to be a journalist, and I wanted to prove it. That is why I was always reading some novels and some other books. So my mom knew that I have a will to go back to school. So that is why we settled down as a family, and we made a decision for me to go back to school. And my parents knew how good I am in schoolwork, so they stood up wholeheartedly.
Thank you. Well, it is very clear how good and how excellent both of you are. Thank you so much for your answers for that question and on this panel today. And I'm going to just wrap up now because I would like to thank all of our guests today. So Angel, Nakai, and Method from World Vision in Zimbabwe, Alicia and Rispa from Girls Education Challenge, and Chichi and Mr. Kiru from Population Council and the Government of Kenya. It's been an incredibly rich and interesting discussion. And one of my key takeaways is, although many governments have taken important steps to remove restrictions and discriminatory provisions in their laws and policies, actors at all levels still need to, there's been so much positive work that's been going on to implement these laws and ensure that schools and communities fully include and support students who are pregnant or parents. And there's still work to do. And so certainly we can do this by listening to the voices and views of girls and involve them in decision making. We can certainly do that by enabling system actors to support the pregnant and parenting girls with their education, both informal and informal schools, and definitely ensuring that there are enabling conditions at the community and family levels to support these girls to thrive in education. And we heard some amazing instances as well as ideas and ways that we can go further with this. So I'd really like to thank all of our panelists. I'd like to thank our audience for their wonderful questions and reflections in the chat. There were some really interesting ones, and I'm really sorry that we didn't have time to go through all of them. But it's clear to me that there are people who are very interested in this topic and would like to contribute. And so we at the Girls Education Challenge would like to invite you to contribute and collaborate on a policy brief that we will be developing with World Vision and Population Council on this topic. So I believe my colleague Elisabetta has put in a link in the chat where you can register your interest as well as provide us feedback on this webinar. We're always looking to improve our practice. But thank you for all of the very positive comments. Thank you again to all of our panelists for speaking today, and thank you to our audience for the rich discussion and questions that you've asked. So thank you very much. Like I said, this presentation will be recorded and put onto the YouTube channels for the GEC and World Vision. So please feel free to share the link with colleagues as well. So thanks very much for today. Hope you have a good rest of the day. Take care.
Thank you. Goodbye.
Bye.
Thank you.